Hello, everyone. My name is Hae-young Yun, and I'm the Managing Director of the International Cooperation and Capacity Building Department at KDI School of Public Policy and Management. I'm also a member of the GDLN Global Board and the Global Secretariat. And on behalf of the KDI School and the GDLN, we want to thank all of our GDLN affiliates for working so quickly in getting today's program, the GDLN Global Knowledge Sharing on the Impact and Responses to the Coronavirus 19 together. We also want to welcome all of our speakers and participants who have joined us from all over the world. Before we get started, I wanted to ask and remind everyone on the WebEx to mute their mics when you are not speaking and to unmute them when you do start to speak. This is actually very critical for our WebEx to run smoothly. As the entire world has been affected by this global pandemic, coronavirus disease 19, the GDLN, in its 20 years of experience, has been very quick to respond to crises that expand beyond our one country's borders or even a region by sharing our respective experiences and know-how. Since we operate via various platforms and do not require us to be in the same place at once, we were able to connect with our GDLN affiliates in the Asia-Pacific region to share our respective impact and responses to COVID-19. So we believe that sharing our experiences and expertise is one of the most effective ways we can combat this pandemic. So I'd like to take this opportunity to thank our experts and speakers for giving us their time today. Given the fast pace this virus is moving, these experts have been pulled in a number of different directions lately. So we are truly lucky to have them with us today. So with that, I'd like to pass this virtual mic over to my colleague Gershan, the CEO of the Sri Lanka DLC, to introduce our first speaker. Thank you. And over to you, Gershan.
Thank you, Han. This is DLC Sri Lanka. We are a government organization under the Ministry of Public Administration, local government and provincial councils. And we are very happy to be part of this global knowledge sharing on the COVID-19 virus outbreak. And we have with us Dr. Sudat Samarveera. He is the Chief Epidemiologist from the Epidemiology Unit of the Ministry of Health, Sri Lanka. And if you talk about the Epidemiology Unit, the surveillance and control of COVID-19 is being carried out under the leadership of this unit. And the Epidemiology Unit is also the co-focal point in the implementation of the international health regulations in Sri Lanka. So without much delay, let me hand this mic over to Dr. Sudat.
Thank you very much for this opportunity to have a platform to share our experiences with the other global community as well as to learn from them. If we talk about the Sri Lanka's experience, that as soon as that we heard about this novel new disease, coronavirus disease, that we started studying this illness as well as it's the global phenomena, and right from the beginning of the evidence that it is spreading out of the China to the other countries and that other countries are at risk. So we started our work. The first thing is that that I can talk that this what we have done here under several headings. That will be this national response, how that started, and what we did with the port of entry, and how we did infection prevention and containment and the quarantine of the people. This is surveillance, laboratory diagnosis, case management, and the risk communication. With the national response that right from the beginning, the government or the President, His Excellency President has appointed an action committee, a national action committee comprising different representatives from all the stakeholders that who are responsible for the action for this type of situation. And also the Ministry of Health appointed the national coordinator for passenger health screening, specifically at our main international airport at Katunayaka. And also that at the Ministry of Health level that we had that established an action committee to liaise with the Director General of Health Services to help him to implement the activities, and also that he appointed subcommittees to oversight the daily operational activities, and also that appoint the national coordinator for quarantine activities, and also that we established an operation room at the ministry level as well as another operation room at the higher level. All these are not happened at the overnight, on a stage basis, with the scaling of the problem at certain levels that we decided and implemented these things. At the ground level, that epidemiology unit is the responsible for disease surveillance and containment of this type of illnesses or diseases. So the epidemiology unit has taken the leadership and the initial steps, mainly that developing that guidelines and the developing of the government circulars and revising them as and when necessary. For example, when the case definition is changing, that we are changing the case definition, that we establish, that we develop these things. That is the main guideline for our healthcare staff to work on. So also that we establish a surveillance mechanism throughout the country, that the surveillance mechanism that we are having a very good network of public health staff that who are working in the field level for the disease surveillance as well as the maternal and child health activities. So through that we implement, that we establish this mechanism, it is geared up the already existing mechanism. We are having the regional epidemiologist in each districts. That means that we are having 26. We are having 26 health districts. We are having 26 regional epidemiologists. Through them we started this surveillance mechanism, and also other supportive documents, formats, those things are developed. And as the epidemiology unit, we coordinated all the things with other different agencies and other stakeholders, and also we ensured that minimum requirement of logistics and other supplies for this containment of disease, because that it is very important at this level, that because this is a contagious disease and the personal protective equipment are very necessary to prevent the spread of disease from person to person, especially that contracting this disease by the healthcare workers. Also that when it is necessary, that we started the contact tracing through this network. When we go to the port of entry, that first thing we implemented is starting completing the health declaration form from all the people who are coming from the identified risk countries, and this is that we implemented not only at the Bandaranaike airport or other airports where the international flights are coming, as well as the seaports, that we implemented the same thing, and the thermal scanners implemented to identify the people who are having the acute illness at that time. Those who are not, those people will be transferred to a hospital for further investigation, and those who are asymptomatic at the time, that who are coming from these countries, were sent to their homes, but advising them to be at their home. So that these details were sent to the regional epidemiologist from our unit, and the regional epidemiologist, what they did is they disseminated this to the field staff at the local level, and they were following up these people whether they are developing symptoms or not. So as well as when the quarantine, infection prevention and containment, these are PHIs, the public health inspectors, did this house visits, as well as that we identified hospitals, if there are any suspected person to be admitted, where there is that enhanced isolation facilities are available. So that by likewise that we identified about 17 to 18 hospitals there for these patients, and also we implemented mandatory quarantine for the people who came from Wuhan. That is about 33 students who returned from Wuhan, and now that we have implemented a mandatory quarantine from people who are returning from South Korea, Italy and Iran, and it will be expanding to some other countries that is who are having high risk thing. The surveillance through the health declaration form, data entry at the management data center, that is being done, all the people who are coming, and I told that it is going to the PHI, public health inspectors, and they are uh, following up the people and reporting us back. As well as now that contact tracing is being done through the same mechanism. As soon as there is a patient that we identify all the people who are having that contacts, these contact people that will be quarantined at their own home until if they develop symptoms, they will be admitted and get the testing done. In the laboratory services, the Sri Lanka is one of the countries in the region that established these PCR testing facilities right from the beginning. Because of that, when we are diagnosing the first patient, uh, in that we could diagnose this patient within 2 days after admission. That diagnosis was done in January 27. That is a foreign national who has come to the country. And for this, we got the support from the Hong Kong University, where the Professor Malik Piris is working. So that we acknowledge them for our support. Now that this facility is established, about 5 centers in the country, and it will be expanding depending on the need. At the moment, that this 5 centers capacity is enough for us. Also, the case management, that's a protocol development and identify the designated hospital for isolation facilities we have done, and the procurement of PPE for the health staff we did, and also that for the case management, now we are with the evolving evidence that we are updating the clinical management guidelines, and the training also we did for the healthcare workers, especially for the medical staff, that will be propagated, that enhance as that when necessary. The risk communication is one of the most important part in this operation, because the most people got panic because of the social media, that a lot of misinformation was circulating. We have to counteract. Because of that, at one stage, that all the face masks available in the pharmacies ran out of stock, because the people were panicked and everybody was wearing a face mask right from the beginning, where there is no at all any evidence that there is that local transmission. So the Health Promotion Bureau has established a special center for this, and they are monitoring the social media, identifying fake newses, and at the same time they are counteracting these things, these fake news. At the same time that they are propagating, that they are disseminating the correct information among the community. Actually, that we can see that although there are some time that from time to time there are escalating of these fake news, and the people are getting panic. But now that most people are aware, and they are cooperating with us and communicating with us and supporting us to contain this disease in the country. We also establish hotline for people at any time that for them to get the information. When we come into the disease situation, only for January 27 that we had the first case as an imported case. The second case diagnosed only more than 1 month later, that is March 11th. That is also a local person that who has in close contact with foreigners, and the next day we reported 2 more cases. On the March 12th, March 13th we had 2 more cases, and March 14th 5 cases, and yesterday we had 8 cases, totaling 19 cases with the first imported case. At the moment we are having 18 cases in the treatment, and actually that we did the mandatory quarantine for these people who are returned from Italy, South Korea and Iran, that its fruitfulness and it is that effectiveness has been very well demonstrated. That a number of cases that is identified during the last 3 days are from these quarantine centers. If they have gone to the home, they should have disseminated this disease to many of the locals. So with that, at the moment that we are confident that we are containing this disease, but still there is a risk that this can be disseminate or the spread within the community, and we are taking maximum precautions. Like today, that is declared a government holiday, and we are thinking of how to limit the people movement further and to reduce the community transmission. Thank you very much.
Thank you very much, Doctor. And with this, we hand it back to Korea. Hyung, thank you.
Thank you very much, Krishan, and thank you very much, Doctor. What I'd like to do now is I'm going to introduce our speaker from Korea. Professor Namgi Park is with Gwangju National University of Education, where he served as its president from 2008 to 2012. He joins us from our KDI school campus in Sejong, Korea, and he'll be speaking to us on COVID-19 and the societal responses in Korea. And with that, I'd like to turn it over to Paul in Sejong.
Hello, everybody. Can you hear me? Here is at 2 o'clock near. Let me share the Korean experience with you. So here, between 40% and 70% of adults worldwide could get the coronavirus on Harvard expert says, and that's at least 3 billion cases. In this case, estimated 48,000 deaths in USA. My question, then, which is the best way? If the Harvard professor is right, which is the best way to respond it? The Korean way, USA way, or Japanese way, or Taiwan way? Because anyhow, it's very hard to stop. This is new, or the first experience that we had in recent times. So here, the Korea case, here, COVID-19 status by country is a private individual person make this kind of site, and they spread it, and everybody see it. You can see the whole world and what. So when you see, then it shows directly what's going on in here. So each country, if you click here, then Iran as of now 13, or China, or Japan, or whatever. So this kind of way, we can see what happens in the whole world. And also, when you see the Korea case of COVID-19 in the Republic of Korea, here, the Korea Center for Disease Control and Prevention released 2 times a day. So this is the yesterday's one. We have total cases, the checked up cases, 268, and among them confirmed is 18,000, and the positive, and like you see it here, and being tested still 16,000, and tested negative is 243,000, like this. So everything is so clearly shared every day. When you go this side, then you can see it directly. So in Korea, the number of confirmed cases like this here is the maximum, and almost 1,000. But now, yesterday, it under the hundreds, so 76 cases, and like this until March 9, and it goes down. And so here, like you see, yesterday, March 15, is a 75 and 76. And daily confirmed counts is going down. And Korea, we have very, this characteristic ways, means 2 districts and the local area, Busan, Daegu, and Gyeonggi province. These 2 areas has almost 90% of cases. So it shows the really characteristic of Korea case. We believe we could stop it, but suddenly it happened. So in the end, it expanded a lot. And this confirmed cases in Daegu is keep increasing, but now it decreased, so we think we can control it. And Gyeonggi province also, it increased, but now it goes down, so we can control. But now Seoul is in problem now, but we think we can still handle it. Because of that, we have very different statistics here. Other country cases, more male get it, but Korea cases, 62% is female. And another thing is Korea case here, very interesting statistics. Age 20, they are almost 30%. This kind of things happens because of one special religion group. And so each country will have different kind of cases. And here the statistics shows you Corona-19 versus MERS and SARS, but anyhow, we don't have enough time, so I'll pass by. And SARS case, nobody passed away at the time. We have 8,000 cases. Year 2012, in MERS case, we have around 2,000, like 400. 2,500 and around 38 passed by. And as of now, Corona-19 case, we have this kind of problem. This is a long time ago. Here it's March 15 statistics. So you can see here, I want to tell you about the medical responses and social responses. So beginning stage, we didn't know that this non-symptomatic infections potential. The Korea Center, they believe they can assure it will be very low. And the mortality rate also, they estimate lower than flu. So government response to China, we just restrict to only from Hubei area from China. But Taiwan at the time already, they stopped, they blocked their borders. That was the difference. And because of that, now Korea spread a lot, and many countries contrary prohibit Korea, and they restricted from Korea. So already 133 countries, as of March 15, they blocked us. So that's kind of the side effect. If you reveal everything, it will happen. And evaluation of government initial response, I won't give them A, except providing overseas travel history. So virus-infected countries, whoever come from there, then maybe like Taiwan, we have to combine with medical, the record, and this kind of travel history combined, and we have to support to the government official or whoever they can see it, and then that will be one of the good way. So here, post-reaction case, later, non-symptomatic infection potential, now they know this is very high and fatal to the old. So government response Korea, only production, the detection case, we have really transparent way. So everything's here released every day, like you said, every day, 2 times a day, it shows what happens there. And contrarily, Japan case, like you know now, they're in trouble, but they don't want to even check the cases. So in the CNN news, they show Japan's coronavirus infection rate could be tip of the iceberg, as experts call for more testing. I will just pass by this one. And Korea case, frequent communication and thorough epidemiological investigation of okay, let me go here. Okay, sorry. And so a Korea case as of now, 268,000 cases we checked. And because of the early treatment of the confirmed patients, the death rate in Korea is only 0.92 versus whole world is 3.84. It's quite different. And COVID-19, we also make the psychological foundation because people, not only physically, psychologically, they damaged. So we make this kind of foundation also. So gains and losses of the Korean reaction, if you try to dig out everything and reveal everything, then maybe you can delay or like this, the death rate will be lower down. But because of that, like I showed you a while ago, many countries blocked Korea. And because of that, we have side effects. But why is it so important to act early on COVID-19? This shows you clearly, if you don't react at first stage, then, then it goes to the wrong way. I mean, many people will die. But if you react directly, strongly, then the death rate will really lower down, but it will be prolonged. So we have to decide if we can choose which one will be better at first strongly or like leave it, or we react strongly. Then if you react strongly, then it goes like this. Let me go to here. So here also transparency. What I want to tell you is Korea case. If somebody got checked up and it's found out that he got it, then it's on your cell phone every day. So many alarms showed up, and it shows where the people go, what time. For 3 days, it shows you clearly, and it also a problem of human rights. But so the government now try to change a little bit. And here, worldwide famous drive-through checking system. So this one now help to the other world. We also have societal responses. So in order to understand, why do we respond that way? You have to understand Korean society. So international situation, politically, economically, we depend on China, and also we heavily depend on the export-import system. So we couldn't just block our border. And social situation, we have high freedom of speech. Government cannot hide anything from people. So that's why they try to be transparent. And also another thing is now high social conflict is, I call it coronavirus, corona politics, because all people try to use as a kind of politics. And our April 15, there is an election. So where the party that has power or other party, they try to use this. So the government, the best way is transparent and communicate with people. And a lot of information, so information overall happens. And you have to understand also Korean medical situation. Our medical infrastructure, quality of medical staff and facilities is quite well equipped, quite really high. In medical doctor, usually they are trained for 10 years. Whoever have chance, then they can check. And even small hospital, if they are ready, then they can do it. So the quality of medical staff is really high. And another thing, we have conscription system. So who graduate from medical school have to go to the military as a doctor or public health center. He has to serve for 3 years. And this time they are very helpful for us. Also, we have nursing officers system. And this kind of system, because of that, we could do what we do now. And we try to fight against the hatred and discrimination. This one is the picture that is fake news, but I thought it's true at the time. It's the Chinese girls who were eating bats. This one made hate the Chinese. And in the end, it found out it was not cooked in China. It was Palau. And we found out that even Koreans are eating bats. And nobody hates this girl, and nobody hates the Korean based on this one. So when they see this one, they hate, but this one they don't. So usually if you have some kind of notification or notion that Chinese eat this kind of awkward food, then they, based on this one, they hate and discriminate. So, and Korea is very highly conflict society. Now, because Corona going on, they say President Moon Jae-in impeachment petition, see, almost 1.5 million agreed. But other team also make the President Moon Jae-in sharing petition, and it's going on now, 1.3 million. It might be more than this, I expect. So like this, Korean society highly compete, compete each other. We are in that situation. And also COVID-19 politics of Korean Medical Association. Korean Medical Association also joined with political party, and they complete each other. So Korea has that kind of situation. You have to understand that one. And about the side effect, because of that, deepening mental and psychological property infringement and destruction of trust, conflicts, fear and hatred spread, and poor social dynamics and economic loss, and disproportionately affecting small business. This is what my friend sent me. Small business, day sales, 0. So many small business now bankrupt now. And intensified international conflict and worsened exchange and panic buying about masks and disinfecting wipes, water, whatever. But Korea case, luckily, they believe in government and no panic buying except masks. So that's a little different from other countries. And also government policies. Government made already comprehensive measures of public welfare and the economy of minimizing the impact of COVID-19 and early detection and containment. Also, they passed a supplementary budget, not passed, they are making, is still on the Congress. So almost $10 billion USD. And we make the 3X, change the X, so it helps this coronavirus 19. And about the societal adjustment, Korean churches, online lecture and worships going on, and statements that promote empathy and encouragement. About job, surge in telecommuting, and telemedicine. It was hard before, but because of this COVID-19, the medical groups, no way they join with us. And lifting restrictions on the separation of financial network. Also, we try to do pain sharing campaigns. I wrote in the newspaper, for example, like this kind of suggest, let's share our salary with the person who couldn't have any income for March. So this kind of things is going on. And I got this idea from Singapore, who donate their money from president to the Congress and high public officials. So I would suggest to the Korean government and Congress also, and one congressman began to donate, but not the government yet. I think they will follow soon. And donation and rent reduction from the private person, we try to do that. And here, very interesting news. Koreans whose hobby is overcoming a national crisis. In national crisis, Korean people gather together and we work really hard to overcome it. So we are lacking of masks. So many people go to the company, factory, and they help. So suddenly they could make 3 times more than before. So it has this kind of news. So implications of Korean societal responses. About medical response, all the time we have to think about your situation, limitations. If you don't have enough public health systems, you cannot follow Korean system, I think. You have to think about your systems. And there are gains and losses. Like I told you, if you reveal everything, then all country block you. Then what should we do? If you hide, then people will be panic and they don't believe you. So I think politically there will be some kind of a golden mean will be there, I think. And then should other countries follow the Korean way? I don't think so. You have to think about your situation and about government responses. Like I told you, transparency, frequent communication, and early treatment of confirmed cases. This is Korean responses. And societal responses, statements that promote empathy and encouragement. And we try to fight against hatred and prejudice. And suggestions, then, this is a really important thing. How can we make systems to share the challenging experiences? It will happen again and again. So we really have to do that. And I want to suggest that UN's initiative really, we need that. Establishing international principles to follow in the event of the new virus outbreak. If not, then they will just follow the scenario, that the worst scenario. Then each country will just block their border, then I think whole world will be in panic. So we have to develop a system to lessen the impact of the international production system. So I want to close with this statement. UNESCO preamble to the Constitution, it says that since wars begin in the mind of man, it is in the minds of man that the defenses of peace must be constructed. I think we should remember this one for overcoming this COVID-19. So here, the hope of mankind, Li Wenliang in China and Korean nursing officer, they put masks too long and it hurt their skin. Even they put the bandage here, then they try to fight against. It's Korean kids cheer up the whole world again, fight against COVID-19. Thank you.
Thank you very much, Dr. Park. Moving on, I'd like to go to Australia National University, where the chair of our GDLN Global Board, Dr. Glenn Withers, is going to introduce our next speaker in Singapore. So I'll turn to you, Glenn.
Hi, Young. Welcome from Canberra. Can I be heard? I'm from calling from the Australian National University, participating, and also involved with the Global Development Learning Network on the Global Board, and also chair of Blended Learning International, which we're finding our specialisation in distance learning is proving very useful in the present circumstances. We're a spin-off from the ANU. What I'd like to do, Young, with your permission, is introduce the next 2 speakers, if I might, because we've just had a little microphone problem. We'll fix that up afterwards so that we can move seamlessly between Singapore and Canberra. In Singapore, we're going to hear from Dr. Jay Menon. Jay is now at the Institute for Southeast Asian Studies in Singapore. and that's a very fresh appointment. He's just moved across from the Asian Development Bank in Manila, where he was the lead economist in the office of the chief economist, and Jay has been with the ADB for about 20 years and ISIAS for 20 minutes. So we'll get a particularly ADB perspective. And for a decade before that, I was pleased to know Jay in Australia, where he also worked for some time, including at the Centre for Policy Studies at Monash and Victoria University, which is one of the major modelers, as is, I think, the ANU, for some aspects of the of pandemic transmission into the economy. So Jay is an economist, and he will give us a guidance to some of these major economic issues. And then following Jay, direct from Canberra, which is where we're fixing up the microphone for the follow-on, I'd like to introduce an epidemiologist who's going to join us, who is Meru Shiel, who is a senior research fellow in the ANU College of Health and Medicine. She has a special interest in health emergencies, emerging infectious and vaccine-preventable diseases. Her previous training was actually in life sciences, working on new vaccines and parasite immunology before moving into this public health arena. So again, we've got a splendid combination of her evolution of skills, and most recently, she's been particularly involved in dealing with these issues in the Pacific, as well as having a background in areas ranging from the Pacific through Bangladesh, the Caribbean, and elsewhere. So she's going to be drawing on that perspective, but especially Pacific, but also in Q&A, if anyone wants to follow up with Australia, New Zealand type issues or matters beyond the Pacific. There are, however, important insights that I think that Meru is going to give us for the Pacific Islands as well. So that's the two speakers that I would like to draw to your attention for the next 20 minutes or so, first of all in Singapore and first of all in Canberra. So for now, over to economist Jay Menon.
Thank you very much, Glenn. I'm assuming that everyone can hear me. Let me start by thanking the organizers for having me. As Glenn mentioned, I will try and speak about the likely economic impacts of this dreaded virus for about 10 minutes. And I want to start, however, by again reiterating that this virus, this pandemic, is first and foremost a human tragedy. I think we should not lose sight of that, and especially economists should not lose sight of that as we get carried away with studying the economic impacts. But for the next 10 minutes, let me, with that qualifier, say a bit about what I think the likely economic impacts are going to be. A lot of these economic impacts are introduced as a result of the medical contagion and the measures being introduced to deal with the medical contagion. So the economic impacts will mostly come out as a result of trying to deal with the medical contagion. But the economic contagion is very quickly catching up with the medical contagion. We already have several studies, and they're increasing almost by the day, trying to estimate the economic impacts on economic growth. We have studies by academics, by multilateral agencies, and also the private sector. And there's no time to review all of these studies here today, but just to say that the estimates vary greatly, from relatively minor 1 or 2% of GDP growth to almost apocalyptic 7, 8 or higher percentage of GDP growth. So huge variation and even greater variation across countries and regions. So in that context, I think what would be useful is for me to focus instead on the transmission mechanisms and channels, and also say a little bit about the issues that are important in assessing the assessments themselves, so that we can be better informed in interpreting these numbers for ourselves. And I'll say a little bit about the likely impacts on the region, focusing in on ASEAN mainly, as this is the region I'm most familiar with. Okay. So to begin with, I think the economic impact operates through a number of channels, and each one has its own time dimension. Almost immediately, we have seen the impacts on tourism and business travel and all the industries that are linked to them, airlines, hotels, etc. And these have been very hard hit, and things are worsening almost by the day. Just have to pick up any newspaper to read about these impacts. The supply disruptions emanating mostly from China is reverberating throughout the value chain and is already disrupting production. China is the hub for regional supply chains and also accounts for about 18% of global trade in parts and components. The cost of this supply disruption is going to be very high in the short run. Supply chains produce great benefits in terms of efficiencies, but they're also very fragile. One break in any part of the value chain can lead to its complete collapse. The interdependencies are quite dramatic, and this type of virus and its ramifications highlights this fragility. It's also affecting labor supply through changes in work practices and so on, work from home arrangements. But here, luckily, advances in technology, in telecommunicating, may limit the fall in productivity. All of this will result, however, in sharp declines in domestic demand, and this will be quite apparent very soon. And also because these factors will likely feed on each other, operating through their impact on economic growth. So there will be a compounding effect, and this will magnify and extend the short-run effects into the long run. Right. Now, the highest cost, however, may come from the so-called intangibles, the effects of negative sentiment about growth and the general uncertainty in this climate, which is already affecting financial markets, stock markets, capital markets, and will eventually feed into lower investment, consumption, and growth going forward. There is also concern that the uncertainty over the progression of the virus itself and its impacts is fueling panic, as we heard from the last presenter, fueling panic not just amongst investors and consumers, but even governments. This is leading to possible overreactions by governments with drastic lockdowns coming into place and curfews, and also all kinds of irrational behavior, like hoarding by consumers. Such policies or actions, when overdone or misplaced due to fear and uncertainty, can actually increase the risk of the outcomes that they are designed to mitigate. If the final outcome is rolling recessions around the world, then there will be significant and non-transitory effects on employment and welfare, despite the mounting stimulus measures that are currently being contemplated. Okay, now let me quickly move on to saying a little bit about the impacts in the Asian region, focusing on ASEAN. Singapore, Malaysia, and Thailand are the most heavily engaged in regional supply chains, and they are the most likely to be affected by the reduction in final demands for the goods that these chains produce, and by the restructuring that will take place. All ASEAN countries are heavily dependent on tourism flows, but perhaps Thailand is the most dependent. Taken together, ADB estimates that Thailand could be the worst affected of all the original ASEAN member countries, both the supply chain effects and the tourism effect. Now, Indonesia and the Philippines are also increasing their involvement in regional supply chains, although slowly. So they too will not be immune, but the impacts might be lower on these two countries. Given time, supply-side adjustments will alter trade and investment patterns. The main adjustment will involve relocating certain activities along the supply chain from China to the region, mainly ASEAN. Although this will cause disruption during the relocation phase, some countries in ASEAN could actually benefit from the new investments coming in, and this could mitigate some of the overall negative impacts, but it will not likely reverse them. Other ASEAN countries that are less engaged in this manufacturing supply chain may be affected through different channels. For instance, Cambodia and Laos receive a lot of their foreign investment and capital, as well as aid from China. And they could be badly affected by any marked growth slowdown. There are concerns that the growth rate in China could be halved or more, and this will affect these countries greatly, but also the whole region, as well as the world, as China is a very important player globally. Several Mekong countries and the Philippines in particular do have large overseas foreign worker populations, and any restriction on their movement or employment prospects as the virus spreads globally will have major significant domestic consequences on these countries, as they will in recipient countries. Brunei's heavy reliance on oil exports will mean that the price war indirectly induced will hit it hard. But most ASEAN countries are net importers of oil, and so they will probably benefit from the lower prices of oil, as will the hard-hit transport services sector. Okay, now let me conclude on two cautionary notes. The first is that in identifying both the short and long-run impacts of the COVID-19 virus, it is important to delineate its marginal impact from observed outcomes. This is important because the appropriate response, or so-called remedy, will vary depending on the cause of the observed disruption. Now, COVID-19 comes on top of a number of factors that have already been affecting the region and beyond. Now, even before this outbreak, risks of a global growth slowdown were rising, driven by a number of factors, including a proliferation of free trade disagreements. The restructuring of the regional supply chain had already started, driven initially by rising wages in China some time ago, and accelerated by the US-China trade war more recently. While COVID-19 may further hasten the pace and extent of this restructuring, it is only partly responsible for what we observe and what will happen. It would therefore be misleading to attribute the observed disruption to COVID-19 alone. This is very easy to do, and in fact, it has been happening. Actually, the trade war that preceded it may actually reduce the amount of disruption that COVID-19 will cause, because the restructuring had already started taking place. Finally, any assessment of impacts must recognize that the spread of COVID-19 is evolving in unpredictable ways. The difficulties of estimating the impacts of a shock, which is itself uncertain, self-evident. And so various scenarios must be considered. The scenarios themselves are evolving from day to day. Currently, the trend points to rising risks, sometimes accelerating risks, although this can change very suddenly, as we have seen with previous epidemics. But all of this uncertainty suggests that the need for caution is great, and the need for regular recalibration of our models that try to estimate their impacts are also equally great. With that, I thank you for your attention, and I look forward to the Q&A later on. Thank you.
Thanks very much. I'm going to go back to Glenn.
So I'm going to take over. Can everyone hear me? I can't see the screen. Yeah. Can everyone hear me?
We can hear you. Thank you.
Yes. Okay, great. As Glenn mentioned earlier, so I'm an epidemiologist, and I have been in the Pacific at the start of the response preparedness part of it. So I was actually in the Pacific for measles response in Tonga with the Global Outbreak Alert Response Network and the WHO when the preparedness activities for COVID-19 got activated in the Pacific. So what I'm going to present here, and I'm trying to move my slides. Sorry, we're just having some technical issue and I can't. Apologies, everyone. Okay. Thanks, Jack. There's not that many.
We can see your PowerPoint now.
Okay, great. So I'm just going to start a little bit by acknowledging the Pacific people who I've had the opportunity to work with, the frontline responders, as well as the World Health Organization and the Global Outbreak Alert Response Network that I did go on response with for measles as well as COVID-19. But also just to say that this presentation is in my personal capacity and based on my reflections and learnings as well. And I hope that I can give you a little bit insight into what the response in Pacific is likely to be like and preparedness updates, but also some of the considerations, and looking forward to Q&A from everybody else as well. And so just for those who may not be familiar with the Pacific Island countries and the South Pacific particularly, it comprises of 21 Pacific Island countries and territories, which includes countries like Fiji, Samoa, Tonga, as well. And so they're highly dispersed, vast geographic area. Connectivity is a massive challenge in the Pacific Island countries, and small populations. So how the risk assessment in these countries is conducted is a little bit different to how it might be in some of the bigger countries of the Western Pacific regions, which are landlocked, as well as the Asian region. So for small island developing countries, those considerations are a little bit different. And some of the key, I guess, looking at what the risk assessment for COVID-19 was or is at the start of a response, is looking at the risk of importation. So many countries in the Pacific have one-stop or direct connectivity to China. So when the outbreak started, there was the high risk of importation in some of these countries which had direct connectivity, such as Marshall Islands, but also countries like Tonga and Samoa, which may have high numbers of Chinese migrant populations and visitors, but not direct connectivity, but one-stop connectivity, which still puts it in a moderate to high risk of importation of the disease into these countries. And really what the consideration here, which and I'll talk a little bit around the preparedness activities around that. When you think about the risk of transmission in these countries, the geographic dispersion of how Pacific Island countries are. So, for example, in Tonga, there's about 164 islands, out of which 35 odd islands are inhabited. There's a lot of land connectivity issues. So there might be the main island of Tonga Taupo where the capital is, but there are all these smaller islands that are dispersed, which have connectivity issues. But also often in a lot of Pacific Island countries, the main big islands can have high density. So if there was local transmission or community transmission, it's likely that the virus would spread quite quickly in these settings, and the process of containment would need speed. Another consideration is that many of the Pacific Island countries, like other parts of the world in developing countries, the household sizes are considerably large in smaller dwellings. So there could be anywhere up to 20 people in small houses. So the ability to home quarantine and implementing self-isolation measures can be quite challenging in these contexts, but also, again, when there's limited space, the idea of social distancing, self-isolation can pose additional challenges and probably will need creative measures in that setting as well. And finally, what is the health system capacity to respond? We know in many of these countries there's limited numbers of doctors and nurses, as well as public health experts and epidemiologists. One person tends to wear 5 people's hats and do 5 roles, so that can often be challenging in terms of the human resources. The fatigue from previously responding to measles outbreak, of course, in the region, as we've seen in many other countries with Africa, for example, with Ebola outbreak, the fatigue of responding to outbreaks after outbreaks can be quite stressful for health systems in terms of human resources, but also the actual physical infrastructure in these settings. They often have 1 or 2 big tertiary hospitals in Pacific Island countries, which might have a limited number of beds, limited number of isolation rooms, negative pressure rooms. So those considerations have a big role to play in risk assessment for transmission of COVID-19 as well. And so in this audience, a lot of people would be familiar with the preparedness pillars for this particular response. The WHO released its strategic preparedness and response plan sometime in late January, which really outlines, and I think it was a fantastic way to put our thoughts together early in the response to look at what preparedness should look like for COVID-19. And it has these main 8 pillars around national coordination and planning, risk communication and community engagement, points of entry, operational support and logistics, having strong public health surveillance, rapid response team and case investigation abilities, laboratory diagnoses, infection prevention and control, and clinical management. And talking a little bit about some of these issues, what the key limitations, strengths and limitations in the Pacific might be. So when you think about national coordination and planning, I think a lot of countries have done a fantastic job of pulling together an all-of-government response for national coordination. In Tonga, for example, they started implementing daily coordination meetings from all sectors of the government to discuss their preparedness activities every day, very early on, which really means that it can improve the flow of information, track progress, and also deal with issues like financing very early on and looking at economic impact early on. Risk communication and engagement, like we've learned from the Korea example as well, but in the Pacific, small island countries, social media has, like many parts of the world, social media has a big impact, and many of the countries started doing early community engagement activities. The strength and the challenge in some of these small island countries is the connectivity. They're small communities, so if early community engagement measures are not implemented, they can have other severe impacts because the community loses trust very early in a government. So community engagement from that perspective is really important. And so one of the things that, for example, in Tonga, the government started doing was having outreach programs very early on, every night going to a village and talking about COVID-19 with the community, addressing issues like discrimination against China at the start, but also explaining what COVID-19 meant, implementing measures around hand hygiene, explaining that to the general public as well. Points of entry is an interesting point for small island countries where travel restrictions around airports and ports can have a positive and a negative impact, as we're seeing in a lot of parts of the world. But what it can do in Pacific Island countries is delay the importation of a case. But like many parts of the world, it doesn't limit the entry of the outbreak. But what a lot of Pacific Island countries did do early on was begin active screening of passengers at the airports, and implementing 14-day home quarantine as well in these settings. So that's really, but implementing early surveillance in these settings was quite challenging because you have to delegate your main human resources from the hospital. So the person who's also the public health expert and the health inspector working in the hospital or Ministry of Health also has to go to the airports for screening processes. So finding that balance can be quite challenging in Pacific Island countries. Operational support and logistics, I think, is one of the key things in the Pacific and preparedness was to provide personal protective gear, including masks, identifying needs for ventilators in countries, lab kits, etc., quite early on because of the connectivity issue. Average time for masks to reach a country can be anywhere between up to 10 days because of the connectivity challenge. So I think some of those considerations are a little bit, apart from the global shortage in supplies, I think the time frame with which they get to Pacific Island countries is quite important. And so there have to be early measures in place in identifying supplies of masks, getting them in time, complete protect gowns, gloves, etc. And because of the recent measles outbreak as well, there have been a lot of their existing stocks were already utilized. So that again becomes an evolving situation as well. Surveillance and rapid response and case investigation in the Pacific. Some countries have really strong early warning alert response systems, but they had to implement enhanced surveillance like many other parts of the world. But biggest challenge is, again, not all Pacific Island countries have pre-established rapid response teams, so they're often relying on training new public health workforce and collaboration, and that will really, and which in this point I would like to connect with the idea of lab diagnosis. So we've seen that in the case of COVID-19, early diagnosis is the key. So Korea has done a fantastic job at testing a whole lot of people through their drive-through clinics. However, in the Pacific, until recently, they are mostly reliant on samples being shipped to Australia in Melbourne to the reference lab here for testing, which means every time that there is a suspect case who might present with clinical signs of the infection, that person can be isolated, sample specimens can be collected, but they have to be shipped to another country for testing, which means that there's a time lag before you can know whether a case is a confirmed case or a negative and can be discarded because of the non-specific symptoms. So that time lag means that in that time frame, the teams have to activate early surveillance and response mechanism. Each case has to be treated like a confirmed case until they know that it's negative. All contacts have to be followed up because of the likely impact it can have, and social distancing can have other challenges as well in this context, like I said, household sizes. If infection prevention and control, like many other settings, has massive implications, especially if you don't have sufficient personal protective equipment, and I think early shipment of those is really important, and the threat of nosocomial infection. Few number of hospitals and trained staff as well. Not enough beds are going to have implications, and we'll need creative solutions to how isolation and treatment of cases is done in this setting as well. And so these are just two pictures that I wanted to share. With on the top left is what you're seeing is really one of the key public health experts and the medical officer in Tonga conducting a community engagement public information session very early on in January to make sure that the community was well informed and had trust in the government around transparency around what they were doing and the measures they were doing. And I think that was a fantastic effort at community engagement. And on the bottom right is their daily preparedness task force that meets to discuss preparedness and tracking options in Tonga as well. And I think finally, this is my last slide. I do want to mention another hat that I'm wearing at the moment is through the Global Outbreak Alert Response Network's research arm, GOAN, which sits under WHO, is coordinating research during this particular response to provide feedback and to strengthen the response. So if there is anybody who is interested in this space or doing research and would like to contribute to the global response, please do reach out to us and we'd be happy to share that with a wider group, or if you're looking for collaborations as well, it would be really beneficial to share lessons, research outcomes with the wider community to guide response in other settings as well. And I think I'll end with that slide as well.
Thank you very much. I'd like to go back to Sri Lanka for our final.
So moving on, shall we move on to the WHO office in Sri Lanka? And the speaker today is Dr. Sapumal Dhanapala, the National Professional Officer of the Emergency Response Management Team of the World Health Organization in Sri Lanka. Over to you, Dr. Sapu.
Hi, good morning from Sri Lanka. I hope you can hear me. Can you all hear?
Yes, we can hear you loud and clear. We can see you too.
First of all, I'd like to thank the organizers for inviting the World Health Organization to be part of this webinar. And as all of you are aware, the Director General of WHO, Dr. Tedros, the regional directors, the country representatives, and all of us at WHO are doing our best to assist governments to fight this corona pandemic. So I have a few slides that I would like to reinforce from the WHO side, and based on the country's experience, I'm sure some of the countries which share the experience, like Korea, we are very happy that they have actually been able to reduce the numbers in their own countries. So as all of you are aware, on the 11th of March, WHO declared this as a pandemic. And the reason for that, I'm sure all of you all understood the reason for it. That is because we needed a more comprehensive approach to contain this outbreak or pandemic. And the WHO also felt that countries, if we work together, can change the course of the pandemic, as seen in China and Korea, in Thailand and a few other countries. Just to update the numbers, today's latest figures from WHO says it's the numbers are 153,000, and we are now contributing to approximately 45% of the total cases reported in the world. And if you can see, there are approximately 10,000 new confirmed cases being reported from outside China, and over 400 deaths per day. And also, if you look at the latest figures, we have actually now 143 countries which are affected by this pandemic. So which means a global scenario that we all need to work together. And we need to join hands in doing our interventions. So the numbers, as you can see from this slide, shows the numbers declining in China to very small numbers, while the rest of the world, the numbers keep on increasing. And these data are there in the WHO website. And I'm sure all of you go through the situation report, which is updated every day at 10 o'clock Geneva time. So if you look at the numbers, initially it was China which had the largest numbers, but now you can see by region, Europe is reporting the largest number in the last few days, and which means that there is importance that all countries need to work together. So the reason for why WHO declared a pandemic is because the numbers of cases increased more than 13-fold, and the countries increased, and the numbers reached a large number of over 125,000 cases at that time, and over 4,600 deaths. And also it meant that the countries had to take up urgent and aggressive action if we want to combat this pandemic. The critical preparedness response, as all of you are aware, most of the countries are now prepared to gear to this emergency, as seen on news from all the countries, US, Europe, Australia, all the countries have responded to the call from WHO. And we need to understand that there are four scenarios that we need to be prepared. One is that still a few countries remain with no reported cases, and which means the main message that we need to emphasize in those countries is that they need to improve their preparedness and be prepared to stop any transmission. And in countries like where there are sporadic cases, those countries need to ensure that they stop transmission and make sure that it doesn't go to a clustering mechanism. Third scenario is a clustering, and where once again containment needs to be done and to minimize transmission and prevent spread. But in most countries now, especially in Europe and a few countries, as you see larger numbers, there's community transmission taking place, and which means that we need to somehow contribute to reducing the transmission and try to reduce the impact on the economy and the other services which are hindering people, and which was well articulated by the economists from Australia on the consequences. So this slide shows very clearly that if from the scenario of no cases, we have to somehow prevent a new case coming in, and try to make sure that the clusters are prevented in the case that there are sporadic cases, and need to take action timely to prevent transmission so that we prevent the countries going to community transmission. And once countries reach community transmission stage, they need to then focus their attention to try to reduce the numbers and try to stop the spread in the community. As the previous speaker said, WHO has given very clear guidelines on priority areas that needs to be worked on, and all countries have prepared their preparedness plans and are responding in these 9 areas. It's important that we do not leave any of these areas behind, because we need to ensure that all these pillars are looked into and maximum interventions done by each of these countries. If you look at the current experience of the numbers, like in China, you can see that the case fatality rate reported from Korea, the fatality of those who are older than 50 years is much higher than the younger population. And the numbers are seen in the next slide. The case fatality rate, which is less than 0.2 in the less than 50s, go up to 0.6 and up to 3.1%. So it's important that we need to focus on the population of over 50. And the same slide shows the numbers. These are shared through the Korean database. And the facts that we need to focus here is that understand that it is possible for people of any age to be infected with COVID-19. And people with pre-existing conditions like blood pressure, diabetes are at a higher risk of severe disease, and the older adults are more at a risk. The risk of severe COVID disease is gradually increasing with the age of over 40 years, as seen in most countries. The key advices that the older adults and people pre-existing conditions need to adhere is that when they have visitors, it is good to have a distance of 1 meter when they greet, either with a wave, a nod, or a bow. Ask visitors and those who are living with you to make sure that they wash their hands, make sure that there is regular cleaning and disinfection. And if someone you live with isn't feeling, to make sure that you limit sharing the utensils, etc., and items. And if you become ill, then you need to make sure that you call up first and go and seek medical care. And it's important that there should be a plan in preparing for outbreak at community level. We need public messages is that when you go out in public, we need to follow the same preventive guidelines as you do at home. And it's important that all of us stay up to date with the information from reliable source, as mentioned earlier, There are WHO websites, CDC, and all the Center for Disease Control in each country have very good, strong websites. They have media briefings done by the officials. And it's important that fake news is countered. And if you see, WHO in the initial stage also had a special area where Mythbusters was used to counter some of the myths which were being channeled through the social media. So we also need to address social fear and stigma, which we saw in the Korean example, where fake news is trying to create certain social phobias, and also it's important that we need to counter them to a maximum as possible. So the idea is that we need to encourage the team and the Minister of Health to use the appropriate terminology when we address the COVID clients. So like people who have COVID, or people who are being treated, and people who died after contracting, and that type of emphasis has to be there, so that we look at it a bit more compassionately. And of course, emphasize on effective prevention and treatment measures, as well as early screening and treatment. Correcting misconceptions through clarifying common myths based on local culture has to be done. And as all speakers mentioned earlier, this is something that is very difficult to do in developing settings, but it's important that these are all corrected. Social media can be a very useful disseminate accurate information by countries, and it's important that we need to have a good information and disseminate accurate information about the areas affected and the individuals. And it's important that sympathetic and local narratives should be done, so that people feel closer when they hear these stories from people who are affected. And it's important that we amplify the voices and stories in each of our own countries, so that people who have recovered and those who supported through recovery are willing to share their stories. Social influence in countries have been used, like was seen in Korea and in other countries, to make sure that the correct messages go off on air, and those who are stigmatized are supported. So in other words, you can use school children quoting different ethnic groups. It's important to promote ethical journalism through working with the media. I'm sure most countries are doing it. We see positive from different countries like Singapore, Thailand, and China and Korea, and a few other countries. And it's important that we create a positive tone with the media that show care and empathy for all. And we do not go into a blame game, because this is not the time that we need to point fingers, but need to work together to ensure all countries unite to fight this pandemic. Health workers, doctors, and all the support staff are always at the front of managing COVID patients or any communicable disease. And sometimes you hear of these health workers who go as frontline workers in managing COVID being discriminated in their own communities and sometimes even in their countries. So it's important that we need to give a morale boosting to this team of heroes who are actually taking the lead in trying to care for these people who are affected. And it's important that we carry on a hero campaign to make sure that health workers and the others are supported more by morale and through words, kind words, and also through statements. And it's important that the isolation facilities and the facilities which are for quarantine, the team leaders are motivated and they are supported to ensure that they have the best possible support services for these affected, both in mental and psychosocial support. Because as all of us are aware, majority of them go through very stressful times, and it's important that these workers are looked into, plus the persons who are affected. So WHO, as all of you are aware, we work at 3 levels. At the global level, we ensure that the policies and the guidelines and the directions are provided to regions, and the regional levels ensure that these guidelines and the monitoring mechanisms are there to ensure that the countries are supported and that the countries' issues are taken forward at HQ level and everywhere. So the countries are supported by both the headquarters and the regional levels to ensure that we provide the best support to governments, and the governments are prepared to face this pandemic to the best possible ability of each of these countries. The different countries have different health systems at different levels, but it's important that all of us work together to ensure that the countries are prepared to the best of their ability to fight this pandemic jointly as a team. So it's important that the whole government approach, as we see in the last 1 week, government heads have come forward. The governments have taken bold decisions about how to prevent or minimize the spread of the disease. And it's important that we need to scale up the emergency response mechanisms. We also need to communicate with the people about the risks and how they can protect themselves without creating unnecessary phobia and panic through the social media, which was seen in the last 1 month, and ensure that we find and isolate and test and treat every case, and we treat and trace every contact. So from the example of Sri Lanka was told by the chief epidemiologist in how they did it. In Korea, it was done. In all the countries, countries are actually trying their level best with the resources to track and treat every case and trace every contact. For this, we need the community support so that they give the correct addresses and the correct contact details. And it's important that we monitor and have adequate human resources to follow up on these contacts. The hospitals need to be well equipped and with trained health workers. And it's important that the confidence in the community is ensured and the community spirit be there to support these patients once they are detected as COVID-19 patients, that they are provided the best possible care and try to ensure that these patients recover and return home to their families safe and sound. There may be, in the unlikely event of a certain number of deaths which are expected, but our aim as WHO and as professionals, doctors, nurses, and all the support health staff and the governments are to ensure that we try to minimize the morbidity and mortality which is seen with the pandemic. So as the World Health Organization, I would like to thank the organizers who are inviting WHO to be part of it. And I'm sure each of you in your countries can contact your country office or the headquarters, go through the website. Our website is extremely good with detailed information about the guidelines being used, the communication tools, the infection prevention, point of entry guidelines, and case management guidelines, and any other information that is there. So I urge all of you to go to the website, use the material, and ensure that we all join hands to protect the global population and try to minimize and overcome this as early as possible. So thank you very much. And these are the additional information sources which I've displayed. I'm sure all of you have already aware of these web links, and we encourage you to use these resources and join hands in the DG's appeal that we join hands to fight this COVID pandemic. And as the UN family, all the UN agents are working jointly as one UN family to support countries to combat the pandemic of COVID-19. So once again, thank you very much.
So now we will hand this over back to Haong.
Hey Young, we can't hear you.
Sorry about that. Can you hear me now? Yes. Okay. First of all, thank you to all of our speakers for joining us today. Given the limited amount of time that we have left, I know there's quite a number of questions out there. We have a few sites who have connected with us via WebEx, and I've asked them through our WebEx chat to send over some questions. So I'm going to take two from there, and then there's quite a number of questions on our YouTube chat platform as well. And what I'd like to ask everyone who's participated today for your understanding that we direct some of those questions that you've presented in the chat, if we could take them online and then direct them to the respective speakers after the WebEx chat. I hope you can understand that because we do have a limited amount of time today. But one of the questions that I would like to direct to our speaker, Jay in Singapore, there is a question from, I believe this is from Nepal, and he is asking what is the financial effect in South Asian countries, if you could speak to that with regards to COVID-19 for South Asian countries. Jay, can I go over to you?
Thank you. Right. Thank you for that question. I guess we haven't heard that much about South Asia and all of this, which is a good thing, I hope. In the sense, I hope it is a good thing, but I hope it's because that infection rates are low rather than the fact that they're not being picked up. In terms of the economic impacts, I guess one of the unusual blessings of not being closely integrated to the global value chain is that you're less interdependent when it comes to, cross-border kind of shocks like this one. A lot of the South Asian countries are not very tightly integrated into global value chains or regional supply chains. And so the reverberations that we are seeing, say, for instance, in the Southeast Asian region, they're quite immune from all of that. Many South Asian countries are also not that integrated financially with the global capital markets. Again, this is normally not a good thing, but in times of high risk and of high contagion, this can actually serve as a good safeguard against contagion. And so those are, they turn into positives when usually they're not. But the overall reduction in global growth that we expect will feed through to all countries, but countries that are more engaged in trade and investment will be most affected. South Asia is not one of those regions, and so maybe the economic impacts will be a bit less. The impacts on people movement might be higher, but generally, I think the fact they're not so integrated will be a positive in terms of mitigating spillover effects.
Thank you so much. I'm going to go over to a question for our speaker in Korea. It's from FETA, our affiliate in Indonesia. They are asking, can you elaborate more on societal empathy activities in Korea? Are they organized by the government or social groups?
Korean situation is very hard to initiate by the government. If the government initiate, then the opposition party will attack the government. So in Korea case, we are really well organized social organizations and NGOs and individual people through the internet or all kind of SNS. So while I show you even my own small articles about they don't less donate 10% of your salary to the people who cannot have any salary for March. So it's initiated by the individual and private or non-NGO kind of the groups. And what government do is support them. For example, if you donate money, then we'll cut down your taxes or what those kind of things. So private person initiate and government follows. That's the Korean system.
Thank you. And one more question for the Korean speaker. This one is coming from our YouTube chat room, just so we can pull one from the many questions that we received today. What is the estimate of the total number of COVID cases in the country versus the total number of confirmed cases? And what is the expected percentage of the population to go through coronavirus?
Yeah, as of now, there is no official estimated cases, but what we believe is estimated case and confirmed cases, there will be no big difference because we really try to check everybody. If there is any suspicious, then we just check it. So we expect maybe it will stop in less than 10,000. Then we are of 50 million, then it might be 0.02%. So we expect, or we hope, it should not be more than 10,000 cases.
Thank you. Unfortunately, I think we have to end the Q&A session at this point. But like I said, we do have an overwhelming number of questions that we've received that we will hopefully be able to direct to the respective speakers. So I'd like to take this opportunity now to, first of all, thank everyone, all of the affiliates who have joined us. There's quite a number that weren't able to speak given the limitations of this platform, but we've had participation from all over the world. I see messages from our affiliates in Tanzania, in Mexico, in Russia. It's been overwhelming, and it's just to prove that this GDLN can be a wonderful platform for us to share our respective experiences with the coronavirus 19. So thank you again. I do encourage everyone to stay connected via the GDLN by liking us on Facebook. It's the GDLN Global Facebook page. We also have a website, gdlnglobal.org. And as we continue to fight the spread of COVID-19 and its overwhelming consequences, we hope everyone stays safe. Remember to wash your hands and to stay on top of the facts. And thank you to all of our experts today for sharing those with us when addressing this pandemic. Thank you for your time. We look forward to seeing you again online sometime soon. Thank you from GDLN Korea. Bye-bye.
Thank you.